So today's story is going to be kind of a part two to yesterday's story of my diagnosis. And sorry, my camera's a little off focus. I'm new to this. But yesterday's story was my diagnosis. So I thought today I would go through the process of what happens after you're diagnosed with cancer. So after the diagnosis, usually your primary care physician, in my case, she called me and she referred me to some oncologist. Typically they'll refer you to a surgical oncologist first, and you'll see that surgical oncologist, and then they'll refer you out to an oncologist because cancer is, once you get the diagnosis, there's still different phases within cancer of treatments that you'll have to do depending on the kind of cancer you have. So for me, like I said in the last video, I'd already had appointments with 3 separate oncologists. Just so happens that one of the oncologists that my primary care physician wanted me to see, I had an appointment with. So I went into that appointment. Actually, that doctor was amazing. He was actually booked up for the next 2 weeks. My mother called for me because I was just, depressed and out of it during this whole time. And he actually made a special appointment for me on a Friday at 6 a.m. I don't know any doctors that make special appointments for people at 6 a.m. but he did. And when we made the appointment, he said, I'm not going to have a lot of time because I have surgery, so I won't be able to give you the full scope of what's going on, but I want you to be calm and I want you to know that, I have your back during this process. When you're diagnosed with cancer, that it was the best thing I could have heard from anybody, because you want that support. You want to know that the doctors are not just looking at you as a case, but as a person. And sometimes, doctors are very busy. We become numbers or charts or cases to them. So, I chose my oncologist because it's very personal to him, my case. He calls just to check up on me. He was saying that his children are my age, so it's very personal to him, my battle right now. Anyway, so long story short, a few days later, we went to his office at 6 a.m. We get to his office, and the staff there is amazing. There wasn't a lot of staff there because they weren't open. They kind of just opened for me at 6 a.m. When I get there, they offer us tea and coffee, and my nerves are so bad. I'm in the car with my mom, vomiting on the way. And that's how I've been kind of dealing with this. I know it's kind of gross, but I just get sick to my stomach. Not so much crying and tears anymore, more just sick to my stomach. So we're on the way there. I'm upset. I'm getting myself together. We're walking into the building. The building says Cancer Institute. Reading that on the building, I don't know what it struck in me, but I lost it. Pull myself together. We get upstairs to his office. He takes us to the back to his personal office, and he sits and he talks to me, and he says, what's your biggest fear? And of course, anybody in this situation, their biggest fear is their mortality, death. And he says to me, well, you're not going to die, so what else is on your list? And, just him laughing and saying that was refreshing. We sat there, and he went from literally point A to point Z of my cancer specifically. Because when you get a biopsy done, they don't only test to tell you that they have cancer, they test to tell you what kind of cancer. They can kind of get an idea of the stage. They can get an idea of a lot of information from just the biopsy, let's say that. So he informed me that my cancer started out in my breast duct, which is, where the milk is formed if you've ever had a baby, and it kind of spread up. He let me know that I would have to go in for a PET scan, a CT scan, and an MRI, just to make sure that the cancer hadn't spread to any other major organs, or that the cancer wasn't anywhere it shouldn't be. I mean, it shouldn't be anywhere in your body, but anywhere else they would need to know. So there's a lot of scans that you have to do that week, a lot of blood testing. For what he did tell me, he told me that cancer has 3 kind of markers. So there's a HER2 positive marker, HER2 positive, HER2 negative marker. There's a progesterone marker, which can be negative or positive. And then there is an estrogen marker, which can be negative or positive, which means that's what drives your cancer. So if your cancer's, like my cancer is estrogen driven, the estrogen in my body is driving my cancer. My cancer was about 90% estrogen positive, 10% progesterone positive, and 0% HER2 negative, which is a good thing because HER2 negative cancers are kind of the bad cancer. All cancer is bad, but it's not the one that you want, that marker. So I was kind of 2 positive, 1 negative, which was good because there's a lot of treatment for estrogen driven cancer, which made me a case of about 90% of the women that get breast cancer. My type of breast cancer would fall into that 90 percentile. So I'm kind of double positive, 1 negative. Some women are triple negative, which is not good. It's a kind of a more deadlier form of breast cancer. So during this process, he's informing me of what kind of cancer I have, what my treatment options are. Once he explains to me that it's estrogen driven, he says, you know, we have this new way, not new, in the last couple of years of treating cancer, especially yours, with, and I'm trying to say the name correctly, it's losing my train of thought. Okay, anyway, I'll think of the name in a second and I'll tell you guys. But my cancer is going to be treated kind of backwards. So I'm going to start with chemotherapy, which back in the day you would start with surgery first, remove the tumor, then they would give you chemo, then they would do radiation. For me now, it's called pre-adjuvant, I believe. I have to check it. I'll put it in the description. But with this type of cancer treatment that we're going to go with, they're going to give me chemo first. And the chemo will tell them a lot because they'll be able to see the tumor in my body and they'll actually be able to watch the tumor react to the chemotherapy. So with that being said, with the chemo treatment, he actually said I'll be able to start to feel my tumor go down in size. With that, it would save some of my lymph nodes. If you don't know, my lymph nodes have been affected by the cancer. It's spread at least to there. So when your lymph nodes are affected and they have to remove them, your lymphatic system runs through your whole body. So if they remove some of your lymph nodes kind of filter out infection. So that's why the cancer cells are kind of stopped there and haven't gone to my organs, because it's a filter. If you do surgery first and they remove the infected lymph nodes, that could affect you later on in life because you don't have anything to stop infection from spreading through your body faster. Also, you're unable to get like lab work done on that side. You're unable to get like blood pressure checks, anything done on that side. Even if you get a cut while cooking, the chances of infection are really bad. Not to mention you get really bad swelling. So with that being said, I was very open to his new form of chemotherapy. So once he told me that we would do it that way, chemo first for 5 months, followed by a 4-week break, then continued on with that with actually, we don't know if we're going to do the mastectomy or just a lumpectomy yet, depending on how much the tumor shrinks. Maybe even save my nipple at this point, which is amazing. They are able to do great things with breast cancer surgeries these days. So, you know, you don't have to be breastless if you don't want to be. Me, I'm not so attached to my breasts in that sense at this point. You know, I've had fun with them, but I could live without them. But he's like, you're young, you're going to need them. So for me, it was a point of just getting to that point when the time comes, seeing how effective the chemo is, what we choose to do as far as lumpectomy, mastectomy. Lumpectomy would be just removing the tumor. A mastectomy would be removing one or both breasts. Typically, women remove both because of the chances of the cancer coming back so high. But now they do genetic testing where they can kind of let you know your percentage of the cancer returning so that you can kind of make that decision yourself. Also, with that, I would have a 4-week break after after the removal or lumpectomy, another 4-week break, and then we would go straight into radiation. Radiation would be followed by reconstruction, which would be at the very end of all of this. And then because my type of cancer is estrogen driven, I would have to get some kind of hormonal therapy. Chemotherapy is already going to take me into kind of an early menopause, but they have a shot that they're giving me to preserve it, kind of like to make all of my lady parts go to sleep for a while. And then they'll wake back up. And in 2 years, you know, I won't be infertile and I'll be functional to have other children. I already have a child. So for me, that decision wasn't so, you know, like I need my ovaries and things because I don't plan on having any more children. But for some women that are young and that are my age going through this, I could not imagine. I mean, they were talking to me at first about freezing my eggs even before starting chemo. Luckily, I didn't have to make that decision off the bat because, you know, I have my child, I'm not married, so it wasn't such a big thing for me. I know they say later in life, you know, think about those things. To me, I just was like, I want to get started. I want to get this out of me. So with that, they talk about staging. They don't like to talk about staging too much in the beginning because staging depends on a lot of your scans. And I'll get into detail about my staging as scans come back and as we get more information. But for my type of cancer, I will be starting off with chemotherapy, followed by some sort of removal. And then we'll be doing radiation and reconstruction, along with the hormone therapy in between that. This whole thing has been, like I said, life-changing, surprising, shocking. The amount of love that I've gotten, you know, these past couple of weeks has been amazing. I didn't even realize how much people love me, honestly. But I just feel like I need to share this story for all women that could potentially go through this or are currently going through this. You know, I was talking to one of the oncologists there, and she's like, you know, some girls come to chemo by themselves. And I have like family members lining up to like come to chemo sessions with me. And that just breaks my heart. So starting my organization, I want to help those women, you know, with financial support or transportation. There's so many programs out there for women dealing with this disease. So I want to help as many women as I can. And that's my mission in this. And watching my journey, like the good, the bad, and the ugly, because when things get a little ugly during this process, you're going to see it because I'm going to be on camera showing it, you know. And I'm not the most social person, very private, but this story needs to be told. It needs to be seen. It needs to be seen in a real way. And, you know, we need to save as many lives as we possibly can. So I'm assuming my next video will go into all of that and my next processes and what I'm dealing with. But like I said, right now, I'm getting ready for my port placement. I've got some scans back. They may want to do one more biopsy, I don't know. But I'm getting my port placement this week. And then next week is chemo. Yay! A lot of women, you know, I saw a lot of stuff on YouTube about chemo and how it's rough. I've talked to some women and they, you know, give me their opinion on it. A lot of women, it's the hair loss thing or, you know, like the early onset menopause. There's a lot of different factors in the chemo that worry me. You know, it's a poison going into your body, ultimately. I look at it like I already kind of have a poison in my body, so, you know. But my chances of survival with doing it this way and with the chemo first are great. So let's just say like that's the plan we're going with. If anything changes, you guys will be the first to know. But I just wanted you to have that part too of like meeting my oncologist, the surgical oncologist. He's great. He's given me his personal phone number. You know, if I have any questions in the middle of the night, or, you know, if I'm having a question with my oncologist, or I'm not doing so okay with, you know, this doctor or this procedure I have to get, you know, I can call him. And you want that great bedside manner. You want that great relationship because this is not easy. And it's okay to cry and it's okay to laugh. I joke about my cancer all the time and it offends people, especially my son. So I'm learning to like work around other people, but you also have to just accept your disease for what it is for you. Understand that you're going through this. And even if you're not alone, you know, it's okay to process it your own way. So I'm hoping that this helps other women process their disease and get better. So I'll see you guys next time. Love, light, and love.